Hello everyone and welcome to OPJ Hub. I'm so excited to see you once again. So we are going to start a very new, interesting and wonderful series which will be termed The Untold Health Stories. I personally believe that there are a lot of health stories which have not yet been told, and so we are going to tell them here as it is, and we will learn the lessons right from these stories. I will also share my medical perspective and my personal opinion. And if you also have interesting stories, you can share it in the comment section, and together we can all learn the lessons. I strongly believe that someone's story told today can be a protective tool or can save someone's life tomorrow. So join me as we follow this interesting story and we pick the lessons. So let's begin with this wonderful story. One evening around 6:30 p.m. at Ho Domain, there was a woman named Enyunam, a 32-year-old who stays in a family house. Okay, all of a sudden she just said she has a severe abdominal pain. At first, her family thought it's just because of the gobe she ate that afternoon, so there's a lot of gas in her stomach, so she should just, relax and take some time off and she'll be fine. But within some few 30 minutes thereabout, the pain was still becoming worse. So they decided to, give her some herbal concoctions and other medications for her to relieve the pain. But then still it could not resolve. So, the symptoms became worse. Around 9 p.m. thereabout, Enyunam could not breathe well. She was having severe, pain all over the abdomen. Her temperatures was spiking. Some of the family members started praying, believing God for divine healing. Around 1 a.m. thereabout, at this point, it became more severe and became very unbearable for the family. So they had to rush her to, the hospital. And upon arrival to the hospital, the doctors actually confirmed that she was having a ruptured appendix, and unfortunately, nothing could be done. Even though the doctors tried their best, we lost Enyunam. Enyunam could not make it. And this is very sad. When I heard the story, I was really, really sad. So I just want to share my concerns. Based on the story that was just shared, I have some concerns. The first concern is delay in seeking care. What I realized was that Enyunam and her family actually did not seek care. They seek care though, but it was not early. It was a delayed health care. Probably they could have come to the hospital quite earlier, because this was actually an emergency, and in case of emergency, time is health. But they delayed. But rather what they did was that they suggested to her to rather sleep, and then they ended up giving her some concoction. And I believe a lot of medications that they give, auntie Na, had this medication, so you should try it, it will work for you. And I think that's what they were doing to Enyunam, and Enyunam did that, and the pain was becoming worse. And in the story, some of them were praying. I'm a strong believer, and I believe in God for supernatural healing. But then in the case of emergency, I don't think the prayer could have done much. Okay, so that was the first concern. My second concern was also the self-medication they were giving Enyunam. They were giving her herbal medications and other stuff. And one thing is that I realized they gave her some painkillers, and the painkillers max the pain, because usually when they come to the hospital on time, it's upon the pain and other questions we'll ask, we'll be able to deduce that, or our suspicion of a particular condition will be heightened. Example, she has an abdominal pain, and the pain was maybe at the umbilical area, central part of the abdomen, and then moves to the groin, let's say the right side of the groin. I'll be thinking of appendicitis, probably with nausea and vomiting. Don't forget that the doctors confirmed that it was a ruptured appendix. You see? So once you take the painkiller does not actually solve the problem. It just marks the pain. So you'll not be able to trace the pattern of the pain. And that's what happened in the case of Enyunam. So I believe that self-medication is not actually the best way to go. Now, the second thing was that they delayed reaching the hospital. And the third concern was that the family members actually normalized the pain. I strongly believe that there's some pain that comes and goes. Yeah, obviously this may not be the first abdominal pain Enyunam was having, This could be maybe one of, she's a lady, so some of her menstrual cramps will, show with abdominal pain. But this particular one, it was a persistent pain. So I believe that once it was a persistent pain, within an hour or two, even an hour is too much, they should be heading towards the hospital for further checkup. And they had to wait for about 6:30, 7:30, 8:30, 9:30, about 5 almost to 6 hours before they finally came to the hospital. By then a lot of complications have set in. So that was the third concern. So my suggestion will just be, first of all, when you have any medical condition that needs rapt attention, especially in case of emergency, you need to get to the hospital as soon as possible for the healthcare professionals to actually know what is wrong with you and give you the adequate and the proper treatment. And secondly, also we need to also avoid self-medication in the case of Enyunam, where they had to, I'm sure the family members, because she was in a family house, so obviously the grandfather's pain medication will also be given to her, so we should avoid self-medication. And then finally, if we have any pain, especially if it's beyond normal threshold, we should be seeking medical care. And I believe you enjoyed this story. If personally you have an experience of this, or you know of anyone who also has similar condition and probably maybe share in the same line of this story, you can drop it in the comment section. And I hope you enjoyed every bit of it. Don't forget to like this video and share it to your loved ones and friends so that we all learn the lessons from this video. I don't want this to be your story. I don't want this to happen to any of your family members as well. So share this video, like this video, and until then, see you in the next episode. Bye.